LSINW 2014 on WBBA-TV. My name is Andrew Serafini, and I'm sitting here with Lisa Cohen. Lisa, tell me a little bit about yourself.
Well, thanks, Andrew. I'm really delighted to be here, and it's such a privilege to be at LSINW. I always get so much out of it, and we'll talk about that a little bit. I actually feel like I'm the interloper here when I come to these meetings. I have no background in science. I was pre-med for 1 quarter at the UW, tanked, and then did my backup into journalism and ended up working in television news for 25 years, broadcast news, but had the great good fortune when I was working at the NBC station here in Seattle, King, to be invited to go on one of the Gates Foundation's early international trips with their then co-president, Patty Stonecipher. And I just, we went to Ghana, the Gambia, and South Africa. We spent nearly 3 weeks there. And the first head of global health on that trip for the Gates Foundation, their original head of global health, was the co-founder of PATH. I had never heard of PATH. I didn't know anything about it. This guy is pulling out all their technologies, their vaccine vial monitors, their Unijects. He's showing me how they're saving millions of lives. That combined with seeing the devastation, the impact of not only AIDS, TB, and malaria in these countries, but also kids dying because they didn't get a measles vaccine, and children not living to age 5, and people still succumbing to polio and some of these things. This was in the year 2000, so 14 years ago, and I just came back and thought I need to learn more about this. I wanted to raise PATH's profile in any way I could by volunteering. And then eventually we came up with this idea of creating an alliance of global health organizations here in Seattle. We think here in Washington State that we have the greatest concentration of global health expertise in the world outside of Geneva. And so with the help of PATH and the Gates Foundation, I went around and talked to a lot of the leaders at Seattle Biomed, Infectious Disease Research Institute, Fred Hutch, the UW, WSU, and others, and we created this alliance, the first of its kind in the world, to leverage each other's expertise and help us improve outcomes.
So how has that relationship developed? I mean, have you made any progress? It's one thing to have an organization, but can you do anything?
Yes.
Have you done anything?
That's a great question, and actually at the beginning, when we started this, we said we're going to give this 3 years, see if it adds value. And if it doesn't, then we're going to go away, because the last thing everybody needs is another nonprofit, more meetings to go to. So what we did was set it up as a secretariat inside PATH, had some generous funding from the Gates Foundation to try this experiment. And then we just got people together in the same room. And what made this successful is that we are willing here. We have this culture of collaboration, this culture of compassion, these risk takers and pioneers that come here to the Northwest. They're not as confined as we can be in other parts of the world, so they're willing to take more risks. So we have the founder of Seattle Biomed, Ken Stewart, from more than nearly 40 years ago now, and PATH, the Hutch, and others who are willing to take risks and fail, but they're also willing to sit down at the same table together and learn from each other and share ideas, share successes, and share mistakes they've made along the way. And that often won't happen in other parts of the country where people are so competitive. So the fact that people were willing to get together, and I remember one of our first great successes was actually bringing leaders from those organizations I was talking about to Washington State University. None of the leaders, the head of PATH, Seattle Biomed, the Hutch, others, many from the Gates Foundation had never been to Washington State. Most infectious diseases are animal-borne, and more than about 70%. And we have this amazing School for Global Animal Health at WSU in Pullman. And these folks, the human health and the animal health people, weren't talking to each other. And they didn't know what each other was capable of. So we took 2 sort of field trips over to WSU. And now there's all of this understanding that you need to take animal health into consideration, and that's science as you move along. So there are things like that. We've created a lot of partnerships, introduced organizations to each other, so they're now collaborating. We work with our elected officials to help them understand the economic impact of the global health sector along with the life sciences sector. And I could go on and on. We're doing partnerships with the Seattle Sounders and doing water and sanitation, bringing in faith-based organizations like World Vision, the largest nonprofit, non-governmental organization in the world hadn't been working with PATH or WSU or UW or even Gates Foundation, and we brought those sort of folks together.
So is there anything your Global Health Alliance doesn't do?
We have a team of 4. So
You do all that with a team of 4 people?
they are amazing. They're all younger than I am, and they are the most talented team that you can imagine. We try to be really strategic. We've got a great board now, and because of capacity, you need to think about where you're going to have impact. And as we're making this up as we go, then we're trying to analyze and be very forthright. And in fact, one of the speakers here at LSINW today was saying that you need to act with integrity and say when something isn't working. And we have to be willing to acknowledge that when that doesn't happen. So there are so many more things we want to do, but it's a good start. We've been around for 7 years. We still feel like a startup. But I've got to say, one of the keys to our success has been our partnership with WBBA. We have been partnering since for a number from our inception with WBBA, but most importantly, in the last 6 years, I've got to say that when Chris Rivera understood that had the additive value of global health with life sciences. And while a lot of people think that global health resides within life sciences, actually it's much broader than life sciences. So there's a Venn diagram and there's a lot of overlap there, but we can inform each other and help each other understand about all sorts of things. And so Chris and I serve on each other's boards. We partnered together when WBBA helped create the life sciences sector lead for the governor. When I spoke with him and the governor's office and said, I think it needs to be life sciences and global health, they were completely amenable to that. And there's this generosity of spirit and that goes along with all of this. And I just think it makes us even stronger.
So let's talk a bit more about your relationship with the WVVA. I know that last year Chris came out after working with his team and some other strategists with a 10-year plan,
Yes.
A strategic plan, if you will. And I know that you're a new organization. You've been around for 7 years. You can't always sling from the hip. Do you have any particular plan moving forward?
We do. I'm really fortunate to have a terrific strategic plan, courtesy of work with some of our board members, including Chris, and where some of that aligns with WBBA's. I mean, we all want to grow these sectors. We all want to make this an attractive place to work. And what we try to talk about is providing a campus of activities when we can show that this broad sector works together. I mean, you know this. Your wife is also a scientist and has a life sciences background, so often you are trying to recruit the best people here, and there are 2 scientists in the couple, and so where we can help place other people as we increase the size of this sector, make this an attractive place to work, work with our state government together to figure out how to attract more business, and then also think about those public-private partnerships and product development partnerships, how we can inform each other on how best to work to leverage, because we understand now that we have to do this together. You know, we have to have the academic, we have to have the basic research, we need to think about delivery, we need to think about the cost models at the end, and that's where I think the WBBA membership, there's a lot of overlap with WBBA and WGHA in terms of members, but we have so much to inform each other to make each other, all these organizations, successful.
That's fantastic, and I think it all boils down to communication, collaboration, strategy, and hopefully for years to come, Global Health Alliance and WBBA will continue to partner and to make great things happen here in the global health sector, not only here, but also around the world.
Yes.
Lisa, thank you very much.
Thank you.
And that's a wrap here at the LSINW 2014 on WBBA-TV.